Hello, my name is Allison Warner, and I'm the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Association of Orthodontists and the American Dental Association. Jackie, it's nice to be back with you.
Hi, Allison. Wow, it seems like every week we have a lot of changes that happen and something new for us to talk about.
Yeah, exactly. So today in a weird way, we're going to revisit a topic we've talked about before,
hmm
specifically PPE shortages, but in this case, it's not masks. It's
No.
actually gloves now. And we did touch on this last fall, but there's some news out there, and it's something that orthodontic staff and the doctors really should be aware of. So what have you been hearing, Jackie?
Well, there's, as they say, good news and bad news. The good news is that the supply chain for gowns, disposable gowns, and masks, both procedure mask and for the N95 mask, that supply chain has been refilled. And those are available for purchase. The price is even coming down on it. So that's the bright spot on the horizon. Just like toilet paper was short, the toilet paper got replenished, so did the mask and the gowns. However, there is another concern with PPE now. That's not going to be just a short-term shortage. It could go on for another year, maybe
Okay.
2 years, and that's
Okay.
with exam gloves. We use boxes and boxes of exam gloves in the orthodontic office because we're touching the patient. We're getting up and down to do different procedures. The doctor may come over, the orthodontist, and look in the patient's mouth and then tell the assistant what changes they'd like to make, maybe with the arch wire size or something. And then the assistant will do the procedure, and then the orthodontist will come back and check, yes, this looks like the way that I want this patient's treatment to go for the next 6, 8, 12 weeks, whatever their rotation is. So you can, just hearing me talk about that, you can understand why there might be as many as 6 different pairs of gloves used during that one patient exam. Because the assistant might put on a pair of exam gloves, go ahead and get into the patient's mouth and maybe take off the elastics and take out the arch wire, and then she might take off her gloves because she sees that she's going to have to wait a little while for the doctor to come over and look at the patient. So she takes off of her gloves and goes and does something else in the office for that, maybe 5 minutes. And then the doctor comes over, puts on another pair of gloves, says, oh, I'd like this size arch wire, let's make this change, and da-da. And then the doctor removes his or her gloves, and the assistant goes and puts on a new pair of gloves. And the assistant does that treatment, and then she lets the doctor know she's ready for that final check before the patient leaves. And then she takes off her gloves and ready to make notations on the computer for while the doctor is, and the doctor puts on another pair of gloves. And so you can see how in one patient's care, there could be 6 pairs of gloves. And we've gotten into the habit with the orthodontic clinical team of even wearing medical grade exam gloves to disinfect the unit and to go into the sterilization room.
Okay.
Medical grade exam gloves in the last 30 days have tripled in cost. They have gone from, say, $5 for a box of gloves up to $15. I'm even seeing $20 now. And the distributors are even limiting the number of boxes that they will ship to the office.
Yeah.
I saw one limit of 2 boxes per week. Well, if you're in a busy orthodontic office seeing 80 patients a day, you can understand, after we've talked about, even if you're working efficiently and you only do 3 pairs of gloves for each patient, that 100 gloves in a box. Wow, you're going to go through more than 2 boxes in one day.
Yeah.
So it is going to be an ongoing challenge. Both the FDA and CDC have guidance on gloves. So the FDA has updated their information on medical grade exam gloves. I would invite every orthodontic infection prevention clinical manager and the doctor to look at this FDA page so that they're real clear on what is a medical grade glove and when you
Mhm.
should use it. And basically it comes down to, if you're in the patient's mouth, you should be using a medical grade exam glove.
Right.
Now, if we're not in the patient's mouth, what about other alternatives to help preserve those gloves? We might even be able to use something like these black food handler gloves
Okay.
when we're working in the laboratory. Say you're pouring up an alginate model, or in the
Mhm.
records room doing things. There are alternatives that you could use, these lesser quality, they're not medical grade exam gloves,
Right.
or going to using these utility gloves. Now, you
Oh,
know, you've heard me talk about these utility gloves. Everybody hates using them because they feel like they're bulky and they have less tactile
yeah.
sensitivity. But you
Yeah.
don't need that exam gloves, that medical grade exam glove, to disinfect the operatory. And I
Mm.
would encourage everybody, when they do look at getting the utility gloves, that they always purchase nitrile and purchase the medical type, not the ones that are for industry, for
Ah,
chemical protection and
okay.
everything. Because do you see this hand on the front? When
Mhm.
I take my hand and put it over, let's see if I can do this in reverse. You put your hand right over it. Well, the edge of your little finger comes to which size you wear. So it
Oh,
actually
okay.
has a sizing chart. And these come about 3 pairs for $15. So you
Okay.
could buy a separate pair for each one of the team members and put on those utility gloves when you're cleaning and disinfecting the chair after you dismiss the patient. Use them in the sterilization room when you're transporting instruments from the ultrasonic to rinse them with, when you're taking dirty instruments in. That would help save so many pairs of medical grade exam gloves and a lot of money. It will affect the bottom line. So I
Okay.
would suggest each orthodontic team that you maybe have a 30-minute training session, maybe right
Mhm.
before lunch, on how to use the utility gloves, what's going to be the new protocol in your office, and how you can preserve some of these medical grade gloves, and have the infection prevent control person going through that.
Mhm.
And we're going to have to look at the guidance from CDC and
Right.
from FDA. CDC, when they put out guidance on PPE, they talk about what is best practices for all PPE during normal times, or as they refer to it, conventional times. I think
Mhm.
you can put up the slide right now that shows the
Mm.
3 arrows that move from green to yellow, which we could consider caution, to the
Mhm.
red zone, which is crisis. We're short on PPE. We don't have enough of it. So during the normal times, during conventional times, we'd wear a
Mhm.
new pair of medical grade exam gloves. And if there are plenty of gloves, then yeah, if you wanted to, use those for in the laboratory, or in the
Yeah.
records room when you're doing procedures in there where you're not touching mucosal tissue, then it would be okay. But now we're getting into that contingency area where there's a
Mhm.
shortage of gloves and we need to look at preserving them. And
Right.
what CDC is saying is, if you get into that area and you're running low on gloves, then you can't care for patients.
Right.
So the orthodontic team may look, hey, if we're really low on gloves, maybe you cancel some of those appointments that are not as urgent. And of
Yeah.
course, we consider every patient important,
Mhm.
but maybe it's one of the OBS club patients, that
Yeah.
7-year-old or 8-year-old that you got on observation schedule. Could you push that out until another month or two, until you have an adequate supply of PPE? Or maybe even that annual retainer check patient that's just coming in to see, hey, how's everything going? And they're even post-treatment a year or two. Could that be postponed? And then
Mhm.
we would get into crisis capacity. And CDC even talks about, and remember, this guidance is for medical communities, not just for
Right.
dental and not just for ortho offices.
Yeah.
But imagine working in a hospital and it's a life or death situation, and the hospital is out of medical grade exam gloves, and they need to intubate a patient, or that patient is not going to survive, and yet
Mhm.
they don't have another pair of gloves. And that's
Right.
when in CDC they said, in a crisis capacity, that yes, you could extend the use of gloves and actually sanitize those medical grade exam gloves with maybe alcohol-based hand sanitizer. And they go into great detail with it about you would stay with what they call cohorted patients, maybe in a COVID unit where all of those patients would be infected with COVID, that you would, sanitize in between, not obviously not for routine use in an
Right.
orthodontic office. And then one step further, again, crisis capacity, is it life or death? To even disinfect the gloves. And one of the recommendations was to use a dilute bleach solution that you would put a third of a cup of bleach in a gallon of water and dip your hands with the gloves on them into this bleach solution for 5 seconds, pull them out, and then you have to wait 1 minute for that contact time to kill any of the microorganisms. And you're supposed to examine the gloves for any tears or nicks, or if they've become tacky in between, means that the material's breaking down. So there's a lot of complex information. Please, I'm going to urge all orthodontic offices, as you look at this crisis supply, that you look at alternatives. Maybe you don't use just nitrile gloves, that you look at some of the chlorpine gloves, or see if you can find vinyl medical grade gloves. I certainly, I've heard the proposal, well, we'll go back to latex. There are some latex gloves available. I get really concerned about latex allergies.
Right.
And that doesn't just happen when you touch a patient and you go into their mouth, but when you pull those gloves out of the box, it releases latex proteins into the air, and takes many hours for those to settle in the air. And just breathing those proteins for someone who's highly sensitive to latex could stimulate an allergic reaction that could cause an emergency in the orthodontic practice. So lots of serious considerations with the glove shortage, and we need to prepare for it now and get ready. And so we've come up with some good ideas. And if anyone listening to the video has any other suggestions, I would appreciate it, because we always want to expand our infection control knowledge, and we need knowledgeable infection preventionists in the orthodontic office.
Yeah, exactly. Well, before we wrap up this episode, as our viewers know, last week we announced the winners of the inaugural Sparkle and Shine Scholarship. Now, this scholarship was set up by you, Jackie, to help orthodontic staff member attend the OSAP virtual boot camp next week. Now, I know your goal with this scholarship is to train the future orthodontic infection prevention experts, but it's also to bring some new energy and new people into the field. So hopefully, eventually, you can retire. And if anything, the pandemic has shown us how important it is to have someone who is knowledgeable about infection prevention in the orthodontic setting. And so, before we end this episode, you had a chance to speak to some of the winners, and we wanted to share some of what they had to say about why they applied for the scholarship and their goals for the future. So we'll take a look at that.
So I've been working with State College Orthodontics since 2018. However, I've been working in orthodontics since 2009, and I've always been a chairside assistant. I've done front desk work. I've kind of worked everywhere within the practice, but I'm mainly a chairside assistant. And then newly, trying to train as OSHA coordinator for State College Orthodontics.
And I am a registered dental assistant through the state of California. I started as a dental assistant with my uncle, who's a dentist, when I was 16 years old. Ideally, I wanted to become a dentist, but then I realized, there's 8 years of school. And after my first year of college, I was just like, nope, I'm going to become a dental assistant. And I excelled. I loved it so much. After dental assisting school, I went and I got my license through the state of California right away. And I got a job in an orthodontic office. And that ortho office was able to teach me so many skills. From there, I was able to get a job as a dental assistant teacher through the high school district, and just be able to see the students and their love of dentistry from what I was teaching them, and they were excelling, and the school district was able to see that they were excelling, and I was offered a full-time teaching position in a high school, and since then I love it. And I was able to be part of an organization called CADAT, California Association of Dental Assistant Teachers, to be able to be a better dental assistant teacher for my students. And
I got started in orthodontics when I was in high school. I was a sterilization student through my practice. I did that my senior year of high school, and then I went to college at the University of Wisconsin-Whitewater for biology. And then on my breaks and days I didn't have class, I would come back home and work, and I slowly was trained how to work chairside. So then I became an orthodontic assistant.
Through the state of California, dental assistants are required to have their California law infection control. They're required to have their CPR, and they're required to have, well, they're not required, but they should have their X-ray license. So I'm hoping to learn all the things that I need to know to implement infection control and add the California law aspect to a curriculum through the school district, so that when my students leave the dental assistant program, they'll have all three of those requirements to go work in a dental office. So
I'm always eager to learn more about orthodontics and the dental field and public health. So I'm hoping to learn a bunch of different things from professionals, from international to national people, and I don't know, just learn as much as I can.
So I think it'll just, in general, help me all over the place, but I'm really hoping that it's just like a platform for me to really understand my role in OSHA, understand OSHA in general, and just kind of learn a lot of the fundamentals and the basics, and just how we were talking earlier, just have resources for me, because I just a lot of the times go in myself and don't really have anyone, especially in the State College area, to go to with OSHA for dental offices. So I just feel like it's going to be a huge platform for me just to be able to learn more and have resources and just really get down with all the OSHA stuff and be able to present my team with good information that can also help them day to day and get through and be the best that we can for our patients and us with OSHA. So.
Oh, Allison, thank you for showing those clips from my Zoom meetings. And then we recorded a video with each one of the 3 Orthodontic Sparkle and Shine winners for the OSAP Infection Control Bootcamp 2021. I am so excited about all 3 of these orthodontic professionals, and they all come from a different perspective in looking at infection control in orthodontics. As you noticed, Sammy is a great orthodontic assistant. Talk about boots on the ground. She hopes to bring back information for her team and become more knowledgeable herself. And then we have Malia, who's an educator and teaching orthodontic assistants, and she wants to be the best educator and expand her horizons and provide some consulting. And then we have Valerie, who is well on the way with her master's degree and considering her options and maybe even going into a public health career or possibly becoming an orthodontist. So I was absolutely wowed with all 3 candidates that won the Sparkle and Shine Scholarship. And I hope to look to talk with them after the OSAP bootcamp and see what their perspective was on it and what they take away from it.
Yeah, well, great. Thank you so much, Jackie, for another great conversation this week and for all that great information. We will be back next week for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.